Dr. Malone, you hear me okay?
I do.
Very good. So we're here July 1st, 2020. You and I started these videos talking about the COVID virus back in March, when the office and pretty much all of Pensacola started to recognize. I think actually we were on the front end of that a couple of weeks. We started working remotely and have been working remotely since. We tried to, when the city decided and the state decided to reopen in a careless fashion, we now know, we continued to work remotely with the high-risk people staying at home, and we continued to do social distancing and some masking. There was, I guess, a week or two where we were actually letting clients into the office as long as we, exercise social distancing and masking and proper
wiping surfaces,
hygiene techniques or whatever. And here we are in July, and I just got an email or text message from P&J that said there was 3 ICU beds left, and you checked the website of a lady that used to work for the Department of Health here. They got fired because she was trying to tell the truth, and she says there's 2 ICU beds left in the county. So we went from having plenty of ICU beds. I remember doing a couple of videos where you actually said that, to now we have 2 in the county. And I guess the concerning part is, I don't think anybody's taking this seriously the mayor last week, thankfully, came around to the masking thing. We still have big segments of the population like Milton that is revolted against the masking ordinance or order for whatever reason, I guess because they think it's going to disappear. So in any event, now we're dealing with a situation where our office staff has been indirectly affected. Last week, we had a roommate of one of the paralegals that came down with the virus, and so we had to go on lockdown and we all got tested, and thankfully we all tested negative. And then this week, another roommate of a 20-something-year-old of another employee that works here tested positive, and so that employee was had to stay home this week, and she, of course, takes 5 days to get your results, even if they're positive now. And she got her results today, and she's positive. So we, as a firm, are going back to 100% remote work. Nobody's going to be in the office except for lawyers. Everybody's going to be working at 100% capacity, but we're all going to be working remote again. And what's unfortunate about this is that the state and local governments, in my opinion, should have reopened with more caution, and they should have reopened with masking and some contact tracing, and like we've been talking about all along, and proper social distancing mandates. The masking thing should have been in effect when we reopened. It wasn't until Friday. Anyway. Number-wise, Dr. Malone, I guess the worrisome part is I heard Arizona had a 28% positive rate. So again, when we say percent positive, for you folks out there that like to deny science, percent positive has nothing to do with the number of tests. Okay? So yes, everybody agrees that the number of tests has gone up significantly, but we're not talking about that. We're talking about percent of the tests that are done that are positive. Okay? That number is up. And in Arizona, it's really bad. It's 1 in every 3 persons that's tested is testing positive. Here, it's hovering between 10 and 13% over the last week. Just to give you a reference, when we were at the height of this, where New York was having all their problems, and everybody here was like, "Why are we even doing this?" And nobody knew anybody that had the virus here locally, pretty much. We were at 0.6%, hovering between 0.6% and 2% or 1%. And so if that gives you a frame of reference, we're now hovering around 13% or 10% percent positive. Is that right?
It is. And there was a time back, I guess in early April, when our county was around the 8 to 10% range. for a lot fewer tests. Again, as you mentioned, this is the percent positive that was scary then. And so here we are again with the same percent positive, and it should be just as scary, even though the numbers are, and because the numbers are grossly higher.
All right.
But we dipped down to that 0.5 to 0.8 and 1.0%, probably toward the end of May when we were thinking about, hey, reopening and everything you mentioned, where we were coming back to the office for a couple of weeks. That's when it was in the less than 1%, but now not the case.
Yeah, what should have happened at that point in time is there should have been a masking order at that point in time. Everybody should have been operating like that. Restaurants should have never been reopened for inside dining, ever. That was dumb. I realize that everybody wants these businesses to open, but we can't see clients. Everybody should have been a lot more cautious. They weren't. Bars should have never been opened. Unfortunately, I hate to say that too, but they shouldn't have been. And because if we're gonna eventually get to the point where we can reopen safely, we're gonna have to keep the numbers down, and we're not doing that right now. We're getting ready to max out our hospital ICU beds, right? And I don't think that the sickest people have been affected yet by this surge here locally. I think who's being affected right now are the 20-something-year-olds that ran around straight out to the bars as soon as we reopened and got themselves sick, okay? Now the question is, everybody went and saw their dads on Father's Day, which I saw a ton of pictures of people visiting their dads on Father's Day, and I'm thinking to myself, I'm not sure that's the best thing to do, right? How many of the younger people that got infected locally are now going to spread that virus to older people? Either from workplaces or social activities or church. Churches are not paying any attention to these rules. And so that's my concern, right? From a medical perspective, what are you concerned about? As far, you've been watching these numbers since the beginning of this.
Mm-hmm.
So what is your take on this?
Well, I think about 2 weeks ago, when the county first started, or rather the state was putting out the median age, at the time I said I would become more concerned when despite the median age being lower, that the hospitalization had gone up or that the hospital bed availability had gone down. That's what's concerning to me, is the hospital resources. So, back when we were talking about, all these long-term care facilities have people who are falling ill and dying. And, as tragic as it was, they're people who are older, they have other comorbid conditions, and so it's, at the time, it's a convenient excuse or explanation. And now, you hate to think of middle-aged anybody who's mobile and ambulating in the community who goes to the hospital and needs to go to an ICU bed. I mean, that's scary.
Yeah, I thought to myself, if our community ever got to the point where ICU beds were scarce, I would be concerned. And before we walked in here, I got the thing from the P&J, and then we looked online at the lady that got fired from the Department of Health because she was trying to tell the truth. And her notes that her data shows that there's 2 ICU beds left in the county, in Escambia County. So. Mm-hmm. If I'm in their position, since they hadn't been doing anything up to this point to make sure that this disease was under control, at least until last Friday, the mayor did something. I'd be thinking, okay, what is your backup plan for ICU beds and ventilators if we get to the point where next week this time or 2 weeks from today, we have a rush on the hospitals of older people with the disease that are having serious symptoms? How do you handle those people? Hospital location? What's the story with that?
So my understanding from other communities that have been in this position is, despite having limited ICU beds in the county, there's still 150 ventilators available. So when someone goes in ICU, you're assuming that they're going to the ICU room for ventilatory needs, given the infection, or maybe they need blood pressure support. Well, both of those can be delivered in non-ICU rooms if it comes down to it. So there's other parts of hospitals that can be used for ICU use. It's not ideal, but it can be set up so that you're doing this in in the recovery area from where the surgical suites are. Right. You're using some of the trauma bays, some of the labor and delivery rooms, things like that. But again, you're chewing into the bandwidth of the hospital, so that what if you're using the operating room suites, all of a sudden you're not doing surgery, you're not available to.
Right.
So I think the hospitals will be able to flex a little bit, but it's not going to be all of a sudden like to free up tons of extra beds.
Right. So, Dr. Malone, this was not an ascot. This is my face covering. Sorry, I didn't even know it was on. Yeah, thank you. Could you pull up the website of that young lady who used to work at the Florida Department of Health? That
Yeah.
telling the truth.
Yeah, what I'm going to do is I've grabbed a couple of screenshots here since we've started, just because it's easier for me to share that. She's got, and we're going to share the link to her website. And the reason I can't pull up the live website is it's real twitchy when I try to share it on here.
Okay.
But I'm going to show you guys. This is the stuff that Joe had mentioned. Let's see here. Let me get it pulled up. So this, for instance, is one of her screens for the county. This is her hospital screen for the county, and this is where she's got the ICU beds available in the left-hand column there, and you're able to scroll down and it shows the different hospitals, their bed availability overall, which is all hospital beds, and then it shows their ICU beds in each of the 4 area hospitals. Then you can also see some of the other numbers she's put in there as far as admissions and deaths and all that. So,
and there's no politics in these numbers. The state's numbers have politics in them because those people believe this is going to disappear. Trump was on TV today, actually being interviewed by. He repeated that phrase this afternoon that he thinks it's going to disappear. He hopes, is what he said. He hopes it will. Mm-hmm. And so, since most people should be operating based on science, right? Probably need to go with the data, right? Yep. The data, and Dr. Fauci, they say it's not going to disappear. They say that you have to exercise smart distancing and masking and contact tracing to control the numbers until we get a vaccine. Okay, so that's what needs to happen. But your leaders, a lot of the leaders around here and nationally are not prescribing to science. So you have to do it your own. You have to be your own advocate. There's been a question on Facebook about elective surgeries. Do you think that it would be smart for them to revisit that issue? Or what do you think is going to happen with that, Dr. Malone?
Yes, the answer is yes. I think it's smart to revisit it. And my understanding of in the county, when they rolled out the reopening of using a color-coded system, there were certain, you go from yellow to green to red based upon the resources available in the community. And one of the resources was the hospital, the ICU beds and things like that. So at that point, then you start choking off some of the elective or the non-emergent surgeries, any of those procedures that would put someone in the hospital for a couple of days while they recover. So, if you know someone who, hey, I'm just going in to get my knee scoped. Well, who's to say that you don't have a complication during the procedure that when you expected to go home that afternoon and you end up staying in the ICU for 2 days for whatever reason it is, you can't predict that. So you need to be able to take care of those people along with the people who are acutely ill, from the virus. So when you don't have any ICU beds, then you guys start clamping down on the elective knee scope, for that matter of example.
Has the color changed as far as the warnings are concerned, or what's going on with that? Do you know?
I haven't seen any mention of that. Nothing in the news. And
so if somebody has elective surgery scheduled for next week or later this week or Friday or next week, what should they do? How do they know whether they're having this or not now?
They should probably contact the office where they're scheduling it through. So if it's a doctor's office or the scheduling department at the hospital, because I would expect that the hospitals are going to need to clamp down at this point, especially if there's limited bed availability. And they could have 100 beds in the hospital and have 0 ICU beds, and it could still mean, hey, we can't do some of these procedures because, like I mentioned, we don't know if you're going to require ICU care when you get out of anesthesia. God willing, you don't, but on the off chance that.
So some of the questions that I've gotten this week and last week when we had our own intra-office issues with the virus with employees were, okay, let's say that somebody tests positive on your staff. should everybody get tested? And, last week we did that because there was somebody that actually tested positive, not on our staff last week, but somebody tested positive that lives with somebody on our staff. So all of us went and tested. Thankfully, all of us tested negative, right?
Yep.
So then we had another employee that over the weekend started having symptoms, last past weekend, and it turns out her roommate, again, 20-something-year-old person, had gotten the virus from people that had been hanging out on Crab Island or at a bar somewhere, 20-somethings again, and she got sick over the weekend. And so we all were like, well, do we need to get tested again? We didn't get our test results back from the test we did last Monday until like yesterday, which is crazy. And we all tested negative. So we knew that the person that was in the office last week that ended up with the coronavirus this week had tested negative as of Monday afternoon. Fortunately, we had put in place last week because we all thought that we were worried about the other employee. We all had put in a lot more stringent masking, distancing protocols here in the office last week. And so thankfully, because of that, I think we all hopefully have escaped the transmission of the virus that she must have gotten sometime after Monday because she tested negative on Monday. But the things that I think that people need to know about is, okay, what is the incubation period of the virus? So for instance, if you test negative on a Monday and you're exposed to it Tuesday, when are you likely to start showing symptoms? And I think you had told me earlier.
It's
roughly 3 to 5 days, but there's instances out there where they're saying as long as like 10 days, but I think that's on the real extreme outliers. So it's 3 to 5 days, and for people that are testing positive, the guidance that they're being provided is you need to contact trace from 2 days prior to your symptom onset. So if you had symptom onset on a Saturday, you say, okay, what was I doing on Thursday and Friday? Who was I around? Not because of where I caught it, but because where I may have spread it while I was incubating.
And
so
then,
it's a
and then you
2 day
contact
lag
those
there.
people and tell them that you tested positive and that since you were around them, they might need to get tested, especially if they're having symptoms, but they should basically treat themselves like they have it.
Yep.
In regards to masking and social distancing, even if they're not having symptoms, because you can be an asymptomatic carrier, right? And spread the virus all around and not even know it.
Yeah, and per the CDC, if you had close direct contact with someone who tested positive, the person who tested positive is isolated for 10 days, and provided they're symptom free at the end, they're basically free to go. The people who have had contact with that person actually are supposed to quarantine for 14 days, which is longer, and it's counterintuitive. People don't understand that. So it's a quarantine of 14 days, extreme caution while you monitor your symptoms so you don't spread it to grandma or grandpa or anybody else who you'd hate to get ill.
So folks, your face covering, and I know this is not approved by the CDC. I think if you're having symptoms, you should be wearing an N95 or something more. Actually, they said the double layered cloth masks are also equally effective, it sounds like. This is just a net gaiter, like a fishing net gaiter. But it does, you can double it. You can double it and it goes over your mouth. So
well, that's they're saying any kind of cloth covering is better than nothing at this point, and it's new advice every day. Let me show you, Joe. You had kicked this off with the percent positivity. This is that same Florida COVID Action website that we're going to share the link to. The red graph there, it starts from March through now, and that's the lab positivity. So you can see, like I said, in March we were down at less than 0%, and then into April we got up to that 8 to 10% range, and then we dipped back down to the less than 2%, and now here we are back to 10%.
Hauling ASS right now, right?
Yes, exactly. So
okay.
She's got it on there. It's a good graphic.
Sorry, go ahead, Dr. Malone.
Yep. Well, the only other thing I was going to share, and I don't know if we'll be able to share this, it's a good screenshot that I grabbed as far as giving people some guidance as to what some of the healthcare personnel are being told, and I think that this is something that people could apply to their own home setting.
is basically create a hot zone in your house where when you come in, you basically wipe everything down, disrobe kind of stuff, and put your dirty laundry there, and then clean up, and then have dinner with the family if you're coming home from work or running errands or whatever the case may be. And they're advising healthcare workers to do something similar to this. So you have one area of your house, and everybody else in that area avoids it. So it's like a mud room or something like that, or like a part of the garage, you know, where you can say, hey, I'm going to get cleaned up before I even enter the house if you're afraid of bringing something in. So this is something that I thought was kind of practical. And if people are wondering, like, what can I do besides masking and hand sanitizers and all that, there are some other steps you can do to try and cut some of the transmission down.
And distancing.
Yep. Mm-hmm.
Yep. All right. What I was going to say is, folks, get used to this, right? This is going to be a reality until we have a vaccine. Okay. Just deal with it. Best way you know how. Science is science. Just deal with it. And this is going to be a reality until we have a vaccine. Okay. Thankfully, Dr. Fauci, who I think is overly conservative with his estimates, thinks that there may be one by the first of the year or winter. So that's encouraging. But in the meantime, this is what keeps the numbers down and keeps us in a position where we can deal with the outbreak, okay, as a community, versus having to set up tents for people to get respiration treatment. And I guess we'll have to get respirators potentially from other places. Of course, I don't know. Hopefully people are doing that here. They're arranging for that contingency. I'm hoping that.
Well, there's enough ventilators according to what the county's putting out there. I mean, there's 100.
Yeah, we've said that though about the beds too, in the ICU room. So I'm not.
Yeah.
If I was in charge, I would be going to plan B and C. I'd be thinking, okay, what happens if we get down to this many ventilators? Where are we going to get them from? Where are we going to set up the tents and or the temporary facilities? Are we going to use? Do we have a facility picked out? Do we? You know, that's the kind of things that I think that should be happening, and I'm hoping they are at a either city or county level where we're doing this. Of course, we're going to have the beaches open for July 4th, so that makes no sense, right? And you know, I get that nobody wants to do without the revenue, but at the end of the day, you know, if a third of the people out there are going to be in the hospital next week or 2 weeks from now, I'm not sure that that's a smart trade-off, especially since you're going to be down for over a month probably if you get this virus, and you're not going to be spending any money anywhere other than the hospital. Okay, so as a whole, from an economic perspective, we're going to suffer a lot worse if we don't deal with the numbers this virus can affect. So, all right, Dr. Malone, we're going to keep a daily watch on this, and as needed, we're going to come on and give more information. I encourage people to watch the website. What's the web address for that?
It's Florida COVID Action. So it's the one long word, floridacovidaction.com, and we're going to share that link today.
Yep. I encourage people to go there. Again, it's not a political thing. She got terminated because she would not cooperate with the political verbiage that they wanted her to use. From a science perspective, she refused to do that. So they said, okay, well, you're gone. And so Governor DeSantis is down there acting like things are going to disappear, saying that July 4th will be fine because people will be outside barbecuing, and outside there's a low risk of transmission, so I don't need to do anything. He's just in the same school that the president's in, that things are going to disappear. That's what they're hoping. Herd immunity, disappear, no big deal, don't worry about it. Well, you know what? That might be the way to go, but you also have to be talking about social distancing and masking, which he won't put one on, neither will the governor. And this is what's crazy about this situation, right? So folks, get a mask, get a covering, get something to use, and get acquainted with it, because you're going to be your best friend for the next 5 months or 6 months. Dr. Malone, thank you very much. We'll see y'all later this week with another update. Stay healthy, stay safe, stay distant, and mask. Bye-bye.